You're tuning in to our last story of the day, the all-important caregiver perspective, and we're here with Julie Lykins. For people who may not be familiar with you, could you just briefly tell us about your husband's kidney cancer diagnosis and your experience through his journey?
So my husband, Chris, was diagnosed with kidney cancer in 2019, and he had papillary cell renal cancer. It started in November of 18, where he was complaining of like abdominal pain and acid reflux and all these different things. And he just kept saying it to me. And I just kept saying, go to the doctor. And finally, I just made an appointment to a GI doctor thinking like, well, maybe he's just got heartburn and some indigestion issues. When he was at that appointment, for some reason, they did an abdominal ultrasound and the tech saw a mass on his left kidney. So then we got referred to a urologist. And that urologist did a CT scan and it showed a softball size, cyst or tumor on the left kidney. The doctor, who is also a surgeon, he said, well, there's a 50-50 chance that it could be cancer. It could be, malignant or benign. He's like, you're young, we can just let it ride and see what it is. And Chris and I both looked at each other and were like, 50-50 are not good odds. So at that point, we went ahead and decided to do the surgery. The surgeon came back and said margins were clear. We got it all. So we were all, gung-ho and excited. And then the pathology came back and said that it was stage 2 kidney cancer. So then after that, the process was, getting a CT scan every 6 months for like the next couple years. So he got a follow-up CT scan and it was still clear there was nothing there. And I think he maybe got one more and it was still good, but then COVID and a year went by. And one day we were just like sitting in the garage and he was like, I haven't had a scan in a long time. And I was like, well, like you should do that. So we scheduled the scan and he went and when we got the results back, it had said that the cancer had come back and it was in the kidney bed because they did a whole left nephrectomy because the tumor was so big. And so it was in the kidney bed and then a couple of other spots like on his iliac bone and like pelvic region. So at that point, then we connected with an oncologist at the Christ Hospital up here in Cincinnati. After that, he started with immunotherapy, and he did that for about 3.5 years. Had all the side effects of it, was also taking a chemo pill called Cabometyx. He ended up going on disability at work because he just, didn't have energy to do anything. But infusions worked, for as long as they could. Eventually, towards the end, the cancer had spread to his liver. And once it got to his liver, we were pretty much, there was really nothing. On April 11th, he woke up in extreme pain. And then I took him to the ER and they did a scan. And from his scan that he had in March to the scan in April, the cancer on his liver had basically tripled in size. And so at that point, he was like, I'm done. I don't want to do anything else. I just don't want to be in pain. His pain was controlled. And we came home and he was on hospice. And he was home for 11 days before he passed.
How are you and your children? How are you doing? How are you holding up? How has this last year been since Chris has passed?
Mm-hmm. So I think the first year I was numb. I didn't really feel anything. We had all of the first, so, he died in April. And then we had, Mother's Day, his birthday, Father's Day, our wedding anniversary, all the holidays, and it was just kind of like I was just going through the motions because I was being strong for my kids and my parents, his parents, and everybody else. Granted, I definitely had my times where I just couldn't get out of bed, and thankfully my family lives local, and my mom, came over and kind of stepped in and took care of, things. Um, we did therapy before, Chris's death, so we were all kind of preparing ourselves emotionally. Um, and then my kids did continue therapy afterwards. I did a spouse loss support group, which was fantastic. I would recommend that to everybody. It was so great and really, really helped me personally. Um, and so now that it's been a year, this going into year two has been a little bit more difficult.
What about year two is feeling more difficult?
Like I said, I think year one, it was numb. I was literally numb and not really feeling anything. I wasn't allowing myself to feel. And now it's like I'm allowing when grief comes at me, and it comes at me in the most random times. I'm embracing it and giving myself that grace and that time to sit quietly with it and cry and scream and be guttural and just let it out, because the more it builds up inside, like the worse it is for me. So I think it's just a matter of the band-aid is ripped off, and allowing myself to embrace it versus shoving it down is what's making year two more difficult.
That actually tends to be something that we hear often from caregivers.
Mm-hmm.
It's just that in some capacity of not allowing themselves to feel and then like feeling everything and trying to find their own support while being their loved one's support. So I'd love to know, you mentioned your family. Where and how and what support did you find both during the diagnosis and the experience and treatment, and also now going through the grieving process and the life after?
Mm-hmm. So I think during the process, the diagnosis, the treatment, Chris and I leaned on each other really hard. We had very honest conversations about, um, death, and that this is what is ultimately going to be the end of you. I don't know proper way to put that, but um, and so we really leaned into each other. And then I am lucky enough I am very close with my parents. I am very close with my siblings. I have a brother and a sister, and I have a very close, small circle of friends that, if I had to have my moment of weakness, I would go to them versus putting it on Chris. So um, and then I found a therapist and, did therapy through the cancer center and enrolled the kids in the same cancer center, but with a different therapist, which I think being like um, active in getting them in that while he was still alive was huge. And I went to both of their schools and told them like what was going on. And so that the school knew, so the counselors could check in on them at school. I mean, I was just like, anybody and everybody, I need all of you.
Now, kind of backtracking, you and Chris kind of went through different points in the experience, like the first diagnosis and then the recurrence. What were some of your first thoughts when you heard both diagnoses?
So the first one, had multiple emotions because, at first the surgeon's like, margins are clear. I'm like, oh, that's great. I know what that means. Like, that's fantastic. But then to get, the results of the pathology, like it's stage 2 kidney cancer. And it was kind of like, what do we do with that? Okay, well, then we just get scans and, trying to be diligent about that. And then to have it when it reappeared, um, I I remember I was at work when I got the scan, that it had come back, and I like walked over to one of my friends and I was like, I just need you to read this because I think I know what this is saying, but I just don't know what this is saying. I don't want to know what this is saying. Um, and she read it and she was like, do you want to step off the unit? And I was like, I think so. And, she, was very supportive and, was like, this is what I'm reading. You're reading it right too. This is it. And at that point, then I was like, I gotta go, like, I'm going home. And, Chris was like, you don't need to come home. I'm fine. I'm like, no, no, no. Mm-mm. So, I went into my manager and was like, I'm going home. The second time was a lot more emotional and kind of like a punch in the gut of like, this is real.
Now, where did you look for information both times, right? Like throughout the experience, where are some places that you turn to for information, both for Chris and both for yourself as a caregiver to kind of understand what to do, what you needed to know, how to move forward?
So again, back to your all's Instagram page, I like ran through that thing almost daily, just looking for, reading people's stories and hearing how they felt and what they did. And then just getting on like, different cancer websites. I don't know like specifics, but just kind of like typing in papillary cell renal cancer and then seeing what popped up and just going from there. That I drove myself crazy researching things and like trying to see like, well, how can I be a caregiver? Like, I'm a nurse, I know how to caregive, but like, this is my husband, this is
Right.
different. So I didn't, I just did what I could. Chris didn't really research as much. He just kind of, I think the one thing that he did look up was prognosis, and because that wasn't something that was ever discussed. But with his diagnosis, it was a 5 year or less. And so, like that was in our heads throughout the whole time. And he died April um, of 2024 and was diagnosed in 2019. So, like not even 5 years, almost five, maybe. Um,
And you had made an interesting point about being a nurse and knowing how to caregive, but it's different when it's your partner, when it's your spouse. So how did your relationship with Chris change over the course of his cancer?
So, unfortunately, cancer is stressful and it puts a strain on a relationship. At least it did for us. We definitely, we never really like argued or fought a lot. And then since his diagnosis, I'd say like those 4.5 years, it was very tense because we both had such high emotion and didn't know what to do with it. Um, I'm a very glasses half full person. Chris was a very glasses half empty person. So that was always like a butting of a head. But I would say our relationship got stronger um, because I learned how to just kind of like be a little bit more fluid with everything that he needed. And okay, well, he snapped at me for this. It's fine. We're just going to move forward and go to the next thing and not harp on it. And just, try to, that's when I was like, I'm going to go to therapy because I need someone to talk to. But as far as like caregiver, because I am a nurse, it was very hard to, step into a nurse role with him when I needed to, because I was like, this is my husband.
I will say, I don't know, it's not necessarily common for a lot of caregivers to also be a nurse. So I'd imagine kind of that training also helped you to be able to be there in those moments. So what advice would you have for other caregivers who have to maybe do those same things, but don't necessarily have that training on how to to kind of handle it?
I think the biggest piece of advice for caregivers is to just know that what you're doing is enough. And being there for your person during this time is enough. And like, try not to put so much pressure on yourself to think that you're not doing enough, because you're doing it all. You're doing everything that you can. It was also really big for me to, like, make sure I was taking care of myself and prioritize my health. And even though I was handling him, I would make sure that I could have someone to be here with him, whether his parents, my parents, friends, family. I need to go for a walk, or I need to, go to the grocery store by myself, or I need to just go sit in my car and cry, or I need to take a shower. I just made sure that I made sure that I wasn't losing myself and my health in all of this, because I knew that if something happened to me during that time, then I was no good to anybody. Um, and then, just, I think the most difficult thing was, following his wishes,
Mm.
um, and hearing him say, like, I want to go home on hospice. I want to have the bed in the basement, and I want to watch the Masters, and I want to die at home. And I had to, like, tell the healthcare people that, like, they would come in to do something, and I was like, we're not doing that. He's a DNR. We're going home on hospice. That was probably the hardest thing out of the whole process, was like, I was the one that was voicing that. But following their wishes, I think, is such a respect and a love. And, like, as a caregiver, as hard as it is, do it, because that's what they want.
Can you talk more about the experience of hospice with Chris, kind of how it got started and the support he and you received through it?
Yeah. So when he decided that he wanted to, go home with hospice from the hospital, there was one company here in Northern Kentucky that, came highly recommended. So I reached out to them. They were able to get equipment in our home before Chris even got discharged. So we had a hospital bed, a bedside commode, a bedside table. They have other things, oh, and oxygen. So everything was kind of set up when we came home. Then he could just get settled into that space. He had a hospice nurse that would come, once a week, if not more, to see him, check his vitals, listen to his heart, lungs, manage our medications, because he had a lot of pain. So the pain medications constantly needed to be titrated up and changed. They probably think I was a pain because I call it all the time. But that's what they're there for. They also offered, for someone to come in twice a week to give Chris a bath. Me being a nurse, I know how to do that. So that isn't a service that I needed. They offered a chaplain to come in. Chris wasn't really a religious person, so that wasn't necessarily something that we needed. And then they have social workers who helped with, like, paperwork of a DNR, and then setting up bereavement therapy and counseling for myself and the kids and everybody in our family. So since we used hospice, every single person in our family, his parents, my sister, my brother, everybody was able to go to their local hospice and get therapy for free if needed after the fact, or even during. And hospice has, such a bad rap sometimes, where they think hospice and, like, you go home and then, sorry, you're dead in, a short period of time. And I'm actually working. I'm a nurse now for the hospice company that we used with Chris. And there are patients who have been on hospice for a year or longer. And it's basically just support, is what it is. It is extra support for the family and for the patient, so that the hospice team takes a lot of the burden off of your plate, so that you don't have to worry about giving them a bath, because you have someone that's coming on Tuesdays and Thursdays to do that. You can go to the store and have a volunteer come and sit with your loved one so that you don't worry that they're going to do something willy-nilly while you're gone. Um, I think hospices are a great resource if you qualify for it. That's the big thing because of insurance. But 9 times out of 10, cancer is like an immediate certifier, no matter what. They say to qualify for hospice, you have to have a terminal diagnosis of 6 months or less.
Okay.
But that's not to say that every single person that gets in hospice is going to die in 6 months because it's a support. And I am so thankful that we had that resource and that we had that support, because I don't know what I would have done without having, nurses to kind of bounce things off of, and a doctor in their back pocket that can adjust meds right then and there.
So what would you, or like, what advice would you give to a family that maybe is considering hospice, but maybe is having a hard or difficult time kind of getting over, that uncomfortableness that comes with the idea of hospice, right? Because as you mentioned, like it somewhat gets a bad rap. It's still somewhat stigmatized despite changing so much over the years and being support, that it might just be hard for a caregiver to take that step, or someone going through cancer to take that step. What advice would you give them to make it easier, if you will, to go forward with hospice?
Um, I would say call your local hospice company and just get an evaluation and have the one of the nurses come out and tell you everything that they have to offer and how it goes and how the support is and what the team is. It's not, if you get an evaluation, it's not saying that you're signing up. It's just getting the information, because I'm sure all of the hospice companies work differently, but the same.
Yeah.
And I know because I do a lot of admissions with my hospice company, and that is like the biggest thing is just like giving them the information of you're going to get this, 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 and this. And we are available 24/7. And you can call us at 3 in the morning for anything, and we will talk to you and we will get it handled. And a nurse might come to your house at 3 in the morning. I just think that it's it's not what it used to be.
Yeah.
It's scary, yes. It's emotional, absolutely. But there's so much good and support to be had through hospice. It's just, call call and get them out to your house and let them tell you what they have to offer you.
Well, thank you so much, Julie, for one, sharing your story and your experience, and like sharing Chris with us and your family with us, and also just for all the advice that you've given to the caregivers who are listening in. I know it's going to be incredibly helpful as they move forward in their experience. And thank you to everyone who's been listening and watching.